the more team-like the approach is, and the more varied the expertise is of members of that team, the better by and large the people get served who are being served by whatever this team is doing. Is this more expensive? Yes. So some places try and do it episodically in small bits in, say, their medical centers or at their community mental health centers. But it would be very interesting if we could find a way to make that more economically feasible. And then we have room for everyone who should be on the table. So right now, people are vying for being at the table, and those who have already been vetted, which are not those with the lived experience, they get to the table first. And not everybody gets to the table, even among them who should be there. So I think there's an economic threshold to happen here. But the end run that I see happening now for folks such as yourself, Tony Head, and all the people at Sunstone whose audios were heard on Saturday last weekend, those folks could get training. They could go, if they're eligible, to Oregon, Colorado, and eventually New Mexico here in this country, or if they're Canadian, go work with people in Health Canada if they have the eligibility, and most of them would, if they have a bachelor's level degree at least. Then the lived experience people become those experts that if it were me and I was looking for someone, I'd want to go work with them, as long as there was a nurse or a psychologist or a social worker there also, because I would feel very good about someone who had had a deep dive into having received the medicine they're going to give to me. So I think we'll see lived experienced people, if they can get some training, where they're eligible to get the training and then eligible to practice, and their vehicles for that now, we'll see more of these voices come forward. For instance, we have a couple people like this who've just applied, and they'll be getting enrolled in the program at CIIS, because we're now letting people, outstanding people, such as this is outstanding, enroll in the program to get the clinical training, even though they don't have a clinical license. So other programs will start doing this as well, because we need more people trained. So hold on to your hat, Pedram.